Okay, welcome back. So now we take all of the stuff that we picked up in the field recovery and bring it back to the lab. Furthermore, we now have the tools and time and all of the things we need to really analyze what's happened. Now, today I'm going to talk a little bit more about taphonomic forces and what happened to the body while it was in the grave. We're not going to delve into the trauma just yet. We'll get to that later on. So bringing it back to the lab, the first thing we're going to do with the skeletal elements, if they're not already together in one way or another, we're going to lay all of what we actually have, what we recovered, in anatomical relationship. We're going to kind of lay it out as if it was a body laying on the table. The reason we do this is, one, to get a decent skeletal inventory. In other words, know every bone that we have and piece together bits that are fragmented. The other thing is it lends to what we're going to look for when we return. If we make one or more returns back to police the area and find what we missed. In other words, if we're missing an individual vertebra, or if we're looking for a specific rib, or it's hands and feet. Little quick note on hands and feet. They're often missing, especially if this is a surface find, meaning it was laying on out and it was not buried, or if it was a shallow burial. The reason hands and feet are almost always missing is because scavengers, particularly dogs, dog-like things, for example, coyotes, wolves, other smaller scavengers to a lesser extent, but things like even raccoons or larger scavengers like bears may grab the feet and carry them off. They're easy to pull off, usually, especially after a fair amount of decomposition has happened. Quick note on the feet. They're often in shoes. Shoes and boots retain feet pretty well. So if we manage to find a shoe, oftentimes there are bones inside it. Usually animals won't go through and pull out the feet from the sock or the shoe, but hands, fingers, and if the toes are exposed, those things are going to go fairly quickly. The next thing is we reconstruct the broken elements. Oftentimes we will use some form of glue. We usually use a glue that is relatively not invasive. We tend not to use things like super glue, which would glue it fantastically well, but it's also difficult and destructive to unglue those things if we need to. Also, they can cause difficulty with things like DNA analysis or microanalyses like trace elements and things like that. So usually the glues that we use will be something relatively innocuous, like a watered down Elmer's glue kind of thing, or other types of craft glue that won't do as much damage to it. Step 3, measuring and recording. This is probably the bulk of what we're going to do in the lab. We're getting that skeletal inventory, as I mentioned before. We're doing a lot of measurements. These measurements can help us with understanding whom the person was. When we get into talking about their ancestry or individual look, this is a major step. There are a lot of lab tools that are intended to help with such steps, such as Fordisk. Fordisk is a program, it's a computer program, in which we then enter all of those data that we recorded in the earlier step where we're doing all the measurements. We'll put those data in, usually in millimeters, and then run it through, and it will try to give us an idea of the ancestry of the individual. Doesn't always do a terrific job, and you definitely have to know what you're working with to give this computer program enough tools to actually do its job. Unfortunately, this is one of those tools that is misused more often than it's used properly. And there's a whole lot of little anecdotal things about that I can tell you, but right now let's just leave it as you have to know what you're looking for before you can use this tool to its fullest extent. Soft tissue removal. If there is any soft tissue on it. As I mentioned before, if there's a lot of soft tissue on this individual, it will be a medical examiner case. In other words, they're going to look at the organs, they're going to look at as much of the soft tissues as they can to determine what they can. If there is not enough soft tissue, or if that soft tissue is mummified, or in some other way that it wouldn't really give them much to work with, there are ways for them to work around that, but not 100%. Or if they've already done what they needed to do and then it gets to us. Either way, we want to work with the bones. Therefore, the soft tissue is really in our way more than anything else. So the first thing we do is remove it. There are several ways to remove it. Boiling is one of the preferred methods because it's fast, doesn't require anything special. You just throw the elements into a big pot of boiling water and that flesh virtually falls away from the bone. However, there's some problems with this. The biggest one is the preservation of the bone. A lot of the fats, moisture stabilizing things that are in the bone will be leached out through that process, so it tends to age the bone very quickly. I don't mean it'll give us a false age as to the age of the individual, but it will make the bone break down faster. So we try to avoid that sometimes in some cases. Another way to do it is using bugs. A lot of different bugs that do this. The best one are larvae for wet bone. In other words, bodies that have come back with rotting flesh on them. Really, the go-to animal there is the common blowfly, the housefly. That they leave their eggs all over the surface. Within a very short period of time, those eggs will hatch, and the larvae will go to work, and they will eat all of the wet flesh, the dead flesh, off from the bone. They can strip a bone down in the right conditions very quickly, usually within maybe a week or so. They can break it down if they're in really good conditions and fairly well protected. Lastly, if it's mummified or dried flesh on there, like the gristly flesh that gets stuck on and has mummified, then we'll go to a different bug called a dermestid beetle. They like to eat that dried flesh off from it. Those things are great, and they're very efficient. They do a better job than any human could ever do. However, there are drawbacks. The bugs, number one, you have to have them, especially the dermestid beetles. You usually have to have a colony that you maintain, which is difficult. The other thing is keeping these things protected from not only other animals or other things, but also from the chain of custody has to be maintained. So you've got to keep these things within your lab in a protected, locked environment, and it can get really pretty ripe. So those are some of the downfalls. Other ideas that people have is, for example, using a scalpel to remove that. Very bad idea. The reason is this can closely mimic perimortem damage, meaning it can get confused for something that was associated with this person's death, like cut marks, for example. This is something that we desperately want to avoid. So we generally don't use those methods. We usually use one of these passive methods that will clean the bone but not do any damage to it. Also, there are chemical methods. Again, usually avoided. Same reason as the boiling method, but worse. Chemical methods that would eat away the flesh, like an acid wash, for example, will clearly do a lot of damage to the bone as well, and this is something we want to avoid. So usually the boiling method is as far as we'll go. The insects are usually the preferred method, but we don't often have the time, the place, or the laboratory conditions to do that. So usually boiling is the most common, especially in certain jurisdictions where they're, one, dealing with not, we don't have to preserve this bone for very long. Really, it's going to go into a grave anyway. And secondly, you don't have to keep a colony of these bugs around, and you don't have to deal with the stench for very long. Taphonomy. Taphonomy is what happens to a body after death. Taphonomy means it's the study of the grave conditions. So what we're looking at here is what happens to the body while it's laying out. This is an image taken from the body farm that I mentioned before from Bill Bass in Tennessee. This is showing how the body will decompose in various conditions. This one was wrapped up in a sheet, just a bed sheet. And you'd see the head decomposed faster than other parts, like the torso decomposed relatively slowly, the buttocks very slowly. Right on the lumbar spine area seem to have decomposed faster. And there are several reasons for this irregular decomposition. In other words, it's not uniform across the whole body. Taphonomy can tell us a lot of other things. This reconstruction shows a situation that we would find somewhere usually in Africa. In some cases, we'll see this in other areas like India, where a big cat, usually a cheetah or a cougar, could do it in Southern California, or something like a leopard or a panther. Those big cats will take a body, carry it up into a tree with them. Tigers can do this to some degree as well. And then eat away in a protected zone, in a place where they feel comfortable up in the tree. Then they eat the body and it can fall down. Now that falling may open up into an underground pit, in which case we find a lot of bones. Does this mean a serial killer's been in the area and using that as their drop pit? Maybe, but in this case, no. It's just an animal that was eaten on a person. This happens. It happens. It's not like the animal's going to go to jail. Although sometimes they'll try to hunt and track down which animal did it and kill that animal, but in most cases it's just kind of, well, that's the way the world works. Pseudo pathologies. Now, this requires a lot of explanation. First of all, a pathology. What is pathology? Pathology is any abnormality in a body. So, let me give you some examples. A pathology would be something like a broken bone. Let's say old Uncle Mo broke his leg and then was walking around with a broken leg for years and years and years, and the leg fused abnormally. Let's say somebody had surgery. That would cause a pathology. We would see where that surgical procedure affected the body or the bone. Another pathology might be a disease or a gunshot wound or a wound of any sort, stab wound, a bludgeoning wound. Those are all pathologies. Those are abnormalities that may lead us to understand who this individual was. Pseudo means literally fake. So a pseudo pathology is something that mimics what looks pathological but is in fact something that happened usually in the taphonomic proceedings, meaning something that happened during the burial that mimics something else that could be mistaken as a pathology. Let me give you some examples. This bone, this is an ulna, which is a forearm bone, right? This is one of the bones in your forearm. And in this, you see how it's bent? Where we're looking at this, this is on the left-hand side image of this ulna. It looks bent. Our first inclination would be healed fracture. It was either a broken bone that healed incorrectly with that bend in it, or that the person was born with a pathological bent arm. So this would lead our inquiry to say, hey, did the individual we're looking for or anybody else who's been missing in the area have a bent forearm? But upon closer investigation, here we're looking at the medullary canal. That's that opening that goes through the middle of the bone in long bones that usually in life houses bone marrow. And look at this. What is that? That, ladies and gentlemen, is a tree root. And tree roots can exert a lot of pressure over a long period of time in a wet environment. The tree root caused that bending. So it looks like a fracture or an abnormality that this person had in life, but is in fact something that affected the bone while it was laying buried in this forested area. The bowed bone is not pathological. It was warped post-mortem. Here's a couple others. These are really common, literally everywhere in the world. Do you guys see these marks? Here we've got a tibia, which is one of the lower leg bones. You see these marks? What, did somebody hit this person with an axe or a hatchet? Look at all these chop marks. Here we have a bunch of other really interesting, weird marks around the eye orbit. It looks like somebody was in there with a knife trying to pry out their eye or something like that. In fact, these marks go all the way down here. Do you see how these are very vertical? Do you see how they're parallel to one another, looking like they're going up and down like this? And then here's one off in another angle. Here's another angle. Here's yet another angle. Another one. And these, look, there's two scoops. Two scoops. This one was overdone by this one. Another two scoops. Two scoops here. Two scoops. Two scoops. What am I doing here? What's going on? These are not knife wounds or axe marks or anything else. These are rodent chew marks. Rodents love chewing on dry bone. They do it to wear down their teeth, exercise those chewing muscles. They love it. Also, they get a fair amount of calcium from doing that. Almost every graveyard, every place where you have bones laying around, you'll find rats, mice, and to a lesser degree, beaver, rabbits. All of these are rodents, and all of them will chew away at dry bone. Even your fluffy, cute little bunny rabbit will do it. What is that? Those are chew marks. Here's some more. These are kind of interesting, though. First of all, let's draw your attention to the bone, which is a femur bone on your right. You guys see these chew marks? Now you're starting to get used to seeing these. You see how they're really, really parallel to one another, and that tells us that's a rodent chewing away. Okay, but there's more going on than that. On this one, on the greater trochanter of this bone, here you see some more rat chewing right up here. Rat or mouse or whatever. But then there's some interesting chew marks along here. These don't look like rats or mice, do they? These are rounder. You see these round holes? And they're biting off chunks. I already gave it away. These are bite marks. Look at that. These are typical. This kind of triangular shaped puncture. They're round, and when they first go in, you get this little triangle shape to them. There's a little bit of that going on up here too, on this bone, and around here. So, what do we have? This is typical carnivore chewing. We're talking dogs, bear, things like that. Dogs especially love to do this. If you've ever had a dog and you have a dog chew toy or chew bone, I guarantee this is what it looks like after a short period of time, isn't it? Rawhide, actual bone, they all look like this. Dogs love chewing on bone that's a little wetter. Whereas rodents like the really dry bone, dogs, things like that, really like the wetter bone. That means it's got more blood and gushy bits in it. So, with a bone like this femur here, we have a timeline. The larger carnivores, like dogs, might have even dug this bone out of the grave and started chewing. You see these big rounded puncture marks right along here, right along the edge. And then, now this bone's been exposed for a while, it's laying on the surface. Now we see these rodent marks coming along. So these can tell us that a dog got to it first, then a rodent after a few weeks. This gives us a timeline of how long this body may have been laying out. Here's some that are really interesting. This is, again, from a grave in Peru, but do you see this grave was laid like this. Now, grave robbers went in, pulled out the bones, threw them aside. And there's these really interesting, weird holes in them like this. These are not dog chew bone marks or anything like that. What are these? They're not healed, so it didn't happen during this person's lifetime. What do you think caused those? I'll give you a hint. Your biggest hint is right here. What's that? These are old dried logs. What happened was these bones were laid across these logs in some places. And there's our culprit right there, laying right across the wood. What likes to burrow through wood? Termites. And they went a little too far and were like, whoop, this isn't bone. I mean, this isn't wood. This is bone. And they turned around and went back. Here's another really interesting one. A lot of people associate these with either cancer or they might see it as something that looks like syphilis. For example, the one on the right looks very like extreme syphilis or maybe an injury or anything like that. Nope. The key here is found right here in this transitional area. You see how it's worn down? It's been abraded away. And this right here, the fact that this isn't bone, it's a clear mineral. Any idea? I'll give you another hint on these two. They were found near the ocean. The one on the right, we'll start with the one on the right here. It was buried up to here. Where? Sandy Beach. This is wind and sand erosion from this exposed top of the skull here. And this, all these little growths here, salt. It's salt crystals from the sea spray that over the years solidified and became these kind of crystalline growths out of the top. Really interesting stuff. These are some other things that throw a lot of people off. Here we have damage that's done, but I can tell you right now, this is post-mortem. Furthermore, the coloration is going to tell us this happened in the grave. This is not a pathology. Over here, this is not a pathology either. What this is, these are growths where they happen quite often in human bodies, and they'll never know about it, especially older people, where their cartilage in places, areas like their throat, or in some cases in their spine to a lesser degree, parts of their ribs, things like that, will actually ossify. They become kind of this weird, blotchy, splotchy bone. These aren't pathological. They're not that abnormal. They're fairly normal. It's just part of the aging process. This over here, we've got a lot going on. You've got this breakaway going on and all this broken stuff going on, but the tops of the teeth tell us the most. These roots of the teeth tell us that this happened taphonomically, not beforehand. In fact, what we have here is a typical damage that's done when somebody's digging. It's either a motorized digging tool or somebody with a spade or shovel hit this skull, crack, broke away all of this, chopped off, snipped off the ends, the roots of the teeth here. Also hit it here. Probably coming in from two different directions. One here, and then again from this direction here. Are these real trauma? Here we have cut marks. This is the first rib. It's right up there toward the top of your rib cage, right above your collarbone. And this is the collarbone. We have these straight lines actually associated with each other. Huh. What about here? Here we've got horizontal cut marks. These are right in the top of the rib cage, bottom of the neck. So here we've got, from the same individual, we've got cuts going across right at the top of the rib cage. Here's a big, here we've got this strange cut mark going horizontally right across the throat here, at the top of really the bottom of the neck area. So what's going on? If we have these horizontal cuts going across the collarbone, the first rib, which is just above the collarbone, and then the neck, well, let's give you a larger area view of this whole thing. This is what it would look like on the individual. So here we have the horizontal cut mark on the clavicle or the collarbone, hitting the first rib here, and the neck right here at the top of the rib cage. Any ideas? This is, in fact, trauma. What we're looking at here is somebody had their throat cut. So this is what a real pathology looks like, and they build on each other like that. We need different evidence. Granted, as far as I know, other than somebody trying to deflesh something with a knife or a scalpel, usually these don't show up as a pseudopathology. I don't know of any pseudopathologies that will copy a pathology like this. I just wanted to give you an actual pathology for comparison. Okay, so I will see you guys next time in the next lecture.